They say, how long is it to 4 o'clock? How long is it to 4 o'clock?
Good afternoon to everyone once again. As we begin this ceremony, I recognize the presence of Mrs. Melissa Skerritt, spouse of the Honorable Prime Minister and Parliamentary Representative of the Roseau constituency, Honorable Dr. Kenneth Daru, Minister for Foreign Affairs, International Business and Diaspora Relations, and representative of the Honorable Prime Minister, Honorable Dr. Irvin McIntyre, Minister for Health, Wellness and New Health Investment, Honorable RAYBURN Blackmore, Minister for National Security and Home Affairs and Parliamentary Representative of the Mahaut constituency, Honorable Kent Edwards, Parliamentary Secretary in the Ministry of Health, Wellness and New Health Investment, other honorable members of Cabinet, Ms. Karin Prevot, the Acting Secretary to the Cabinet, other permanent secretaries, Mr. Ahmad Al-Khatib, Project Manager, MMCE, Dr. David Johnson, Chief Medical Officer, Mrs. TERRILLIA RAVALIERE, the Acting Principal Nursing Officer, Mrs. Ermine Renee Roberts, District Nurse, other staff of the Ministry of Health, Wellness and New Health Investment, Pastor LENNOX Timothy, members of the Health Center Commissioning Committee, Ms. Deborah Blanford, family of Ms. Mary Murphy, Mr. Milton David, family of Agatha David Esprit, other invited guests, members of the media, ladies and gentlemen both present and those listening via the various forums. As we continue with our ceremony, I would like to invite Pastor LENNOX Timothy to lead us in prayer.
Just before I pray, I'd just like to read 2 portions of scriptures. Good afternoon, everyone. Now Peter and John went up together into the temple at the hour of prayer, being the 9th hour. And a certain man lame from his mother's womb was carried, whom they laid daily at the gate of the temple, which is called Beautiful, to ask alms of them that entered into the temple, who seeing Peter and John about to go into the temple, asked an alms. And Peter, fastening his eyes upon him with John, said, Look on us. And he gave heed unto them, expecting to receive something of them. Then Peter said, Silver and gold have I none, but such as I have give I thee. in the name of Jesus Christ of Nazareth, rise up and walk. And he took him by the right hand and lifted him up. And immediately his feet and ankle bones received strength. And he leaping up stood and walked and entered with them into the temple, walking and leaping and praising God. And all the people saw him walking and praising God. And finally, beloved, I wish above all things that thou mayest prosper and be in health, even as thy soul prospereth. Let us pray. Our Father and our God, sovereign thou art, we come to you today in the matchless and holy name of our Lord and Savior Jesus Christ. We give thanks to you, dear God, for having carried us through, Father, most of the day already. And even as we gather here this evening for this very special occasion, we want to thank you, Father God, for each and every one, dear God, who was involved and who were very much instrumental in, Father, having this project to come to fruition. And to this day, we can stand at the completion of it. And, Father, to officiate in the fact that it is going to be used for the well-being of our people of this community and environment. Dear God, we recognize that without you, nothing can be done and lasting. And for this reason, dear God, we acknowledge your sovereignty over us, your sovereignty over our nation, and your sovereignty over that which we do. Today, we ask your blessings and grace upon this ceremony, dear Father, and that each and every one who will contribute, Father, in one way or the other, I ask that, Lord, we would receive and would be encouraged and edified thereby. But most above all, you, mighty God, will receive the glory, because it is only through you that we are able to stand here today and to give thanks and praise to you for that which you have done for us. It's not by might, not by power, but by your Spirit, saith you, Lord God. And without you, Father, watching over us, without you giving the grace, without you giving the strength, without you providing there, Father, we are not able to do anything. So because of that, dear Lord, we want to say thank you to you. We want to bless your righteous name, and we say that you take control of this proceeding today. We ask this in Jesus' name.
Thank you, Pastor Timothy. You may be seated. I now invite Honorable Kent Edwards, Parliamentary Secretary in the Ministry of Health, Wellness and New Health Investment, to deliver the welcome remark.
Honorable Melissa Skerrit, spouse of the Prime Minister of Dominica and Parliamentary Representative for the Roseau constituency. Honorable Dr. Kenneth Daru, Minister for Foreign Affairs, International Business and Diaspora Relations and Representative for the Prime Minister. Honorable Dr. Irving McIntyre, Minister for Health, Wellness and New Health Investment. Honorable RAYBURN Blackmore, Minister for National Security, Home Affairs, and Parliamentary Representative for the Mahaut constituency. Other honorable cabinet members, Ms. Karen Privot, Acting Cabinet Secretary, Mrs. Letitia Lestrade-White, Acting Permanent Secretary, Ministry of Health, Wellness and New Health Investment, and other permanent secretaries, Dr. Ahmed Akitab, Project Manager, MMCE, Dr. David Johnson, Chief Medical Officer, Dr. Laura Esprit, Director of Primary Healthcare, Mrs. TERRILLIA RAVALIERE, Acting Principal Nursing Officer, Mrs. Ernie Rainey Roberts, District Nurse, other staff of the Ministry of Health, Wellness and New Health Investment, Pastor LENNOX Timothy, and other invited guests, members of the media, ladies and gentlemen, welcome. It is indeed a great honor to welcome everyone to the commissioning of the and naming of the Mahaut Health Center. The government of Dominica, through the Ministry of Health, Wellness and New Health Investment, embarked on a renovation and of damaged health centers post-Hurricane Maria, and also committed to constructing 12 new health centers throughout various districts. In spite of the challenges that we face as a ministry and as a country, we have remained focused through hard work and determination, critical assessment, planning and implementing strategies we are able to meet today here, although in limited numbers, to commission and name the new Mahaut Health and Wellness Center. This Health and Wellness Center is the first to be commissioned and named out of 6 which have been completed thus far. Having worked as a pharmacist in the primary healthcare services for several years, I am very much aware of the significance and the need to strengthen primary healthcare services. Meeting the primary healthcare needs of our people is of paramount importance, since preventative care contributes to a reduction in the number of persons who require secondary care in Dominica and elsewhere in the world. It is said that, and I am convinced, that prevention is better than cure. How can we do this? We are aware that having the ideal infrastructure is one of the factors that will help us to achieve that strengthening primary healthcare services aimed at promoting wellness and preventing disease rather than having to be managed as complicated diseases in secondary care. And again, I will reiterate that prevention is really better than cure. Although I was asked here to offer welcome remarks, I do welcome every one of you here this afternoon. However, I would like to take this opportunity to encourage all of you to focus on your health, visit your health centers, and listen to the healthcare professionals. You being present here today signals that we are in the right path and we are ready to continue to work with the ministry and the government in taking primary healthcare to the next level. Once again, welcome.
Thank you, Honorable Ed. I now invite Mr. Ahmad, the project manager of Montreal Management Consultants, to give a project overview.
Good evening, ladies and gentlemen. Allow me to recognize a few people. I hereby recognize Mrs. Melissa Skerritt, spouse of the Honorable Prime Minister and Parliamentary Representative of the Roseau constituency, Honorable Kenneth Darrow, Minister for Foreign Affairs, International Business and Diaspora Relations and Representative of the Honorable Prime Minister, Honorable Irvin McIntyre, Minister of Health, Wellness and New Health Investment, Honorable RAYBURN BLACKMOORE, Minister for National Security and Home Affairs and Parliamentary Representative of the Mahaut constituency, Honorable Kent Edwards, Parliamentary Secretary, Ministry of Health, Wellness and New Health Investment, other honorable members of Cabinet, other invited guests, members of the media, ladies and gentlemen, good evening. I stand before you here today as we cross another milestone with the handing over of the Mahaut Health Center. In 2019, the government of Dominica has emphasized the need to update the health facilities around the island, and thus we have been entrusted with developing and building 12 health centers throughout the island. Please allow me to brief you on the progress of these health centers as of today. As of today, we have completed 8 health centers, namely Mahaut, Bellevue, Bagatelle, Georgetown, Wesley, Marigot, Vegas, and Penville. Of course, Penville, we're still working on the exterior works, but the structure has been finished. And we have 4 ongoing health centers with these expected dates of completion. We're expecting Polyho to be finished by the 31st of March, Newtown to be finished in October 2021, Soufriere in October 2021, and Anse-de-Mai 31st of May, God willing. These health centers will transform the healthcare in Dominica. They will empower and engage the communities through the availability of local healthcare options. In compliance with your government requirements and specifications, these health centers are fully equipped for your everyday healthcare needs and convenience for the handicapped and elderly citizens. One thing I have learned about Dominica, we place our elderly first, and I can see such a passion during my discussions with the Ministry of Health. We are also proud to announce the commencement of the construction of the new Mahaut Primary School. We have also been entrusted to develop a modern campus for the grammar school. It is exciting times for all of us to see this come to fruition. Let's talk about the structure for a bit. The structure, a reinforced concrete structure. In this mad era of climate change, we've observed the evidence, and all the evidence do point that the reinforced concrete with high specification is the way to battle such adverse weather. Equipped with impact-resistant windows, we have also considered the possibility of adding shutters to secure both facilities and residents of the centers during adverse weather. The health center consists of, starting with the ground floor, a doctor's office, nurse's office, 2 examination rooms, 2 clinics, and a pharmacy. As for the upstairs, the living area for the nurses, it consists of 2 bedrooms, a kitchen, and a living area, in addition to a sizable balcony. Finally, I reaffirm the importance of our partnership with the government in Dominica in helping attaining proper and sustained development on the island in the areas of housing, health, and education. We look forward to continue serving Dominica. Thank you for coming here today, and of course, one love.
Thank you, Ahmad. This afternoon, the health center, that is Health and Wellness Center, that is being officially commissioned, is also being named after 2 health professionals. Although they have passed away, their services, we are recognizing their contribution to healthcare this afternoon. I invite Ms. TERRILLIA RAVALIERE, who is the Principal Nursing Officer, to read the citation, and whilst reading, you will get to know who are the 2 persons that the health center is being named after.
Mrs. Melissa Skerrit, spouse of the Honorable Prime Minister and parliamentary representative of the Roseau Constituency. Honorable Kenneth Daru, Minister of Foreign Affairs, International Business and Diaspora Relations and representative of the Honorable Prime Minister. Honorable Irvin McIntyre, Minister for Health, Wellness and New Health Investment. Honorable RAYBURN Blackmore, Minister of National Security and Home Affairs and parliamentary representative of the Mahaut Constituency. Honorable Kent Edwards, Parliamentary Secretary in the Ministry of Health, Wellness and New Health Investment. Other honorable members of Cabinet, Ms. Karine Privot, Acting Secretary of the Cabinet, Mrs. Letitia Lestrade-White, Permanent Secretary, Ministry of Health, Wellness and New Health Investment. Other permanent secretaries, Mr. Ahmad Al-Khatib, Project Manager, MMCE, Mrs. Renee Roberts, District Nurse, Pastor LENNOX, other invited guests, members of the media, ladies and gentlemen, pleasant good afternoon. Nurse Agatha Esprit David. Nurse Agatha Esprit David began her nursing career at the tender age of 6, initially as a volunteer nurse and proceeding to become a registered nurse. She devoted 44 years of her life to the institution and would unabashedly recount to her 3 children how difficult the profession was for nursing back. Nurse Esprit, I would ride my bicycle from hospital to Mahaut, and when I get to Les Point, I would free-wheel it down there. There were no street lights back then, and the roads were pitchy. There were no buses, and I would walk for miles, sometimes in pouring rain, lightning, and thunder. If I was lost, somebody would stop. Nurse Agatha Esprit David talked about delivering babies on the bullseye, filled with kerosene, like fluff, and of working without running water, as well as not having any diagnostic equipment and having to sterilize every medical, as very few things. She would tell of how sore and tired her feet would become after trekking through the ISHMAEL later, that's the lake road from Loda to Grand Forks, when she served in these. She talked about having to learn all facets of nursing, since specialized nursing was unheard of back then. Nurse Esprit was passionate about her work and community, assisting the sick, the dying, saving lives, and delivering countless. Her focus was always about making a difference in the community. She cared deeply about others and would find herself involved on many communities as self-help. Many times, she was seen as extending herself over and above the call of duty and sometimes putting herself first. Nurse Esprit believed in people, and whether you were drowning in self-pity, self-doubt, were down on your luck, or felt knocked down by life's challenge, she had a knack for making you feel good life about yourself. She would quickly dispense a strong dose of encouragement and a big bottle of good advice that you would take daily to get back. Nurse Esprit loved children and would make it her business to put them on the straight. She was quick to give them that pep talk about respecting yourself and others and honoring your. She emphasized the importance of staying in school. That's it for Nurse Agatha. Nurse Anastasia Mary Murphy, also known as Nurse Murphy or Teacher Mary, began her nursing career in the early 1960s. Because of the public service policy at the time, she had to leave the service in 1960. During the interim years, though not practiced, patients came to her for their course of injections prescribed by their doctor, dressing their all. Doctors would actually call on her to provide that service. Around 1970, Nurse Murphy returned to the medical field as a nurse's aide at the Dominica. When the opportunity presented itself in the early 1980s, she began training for what was then called the community health nurse, in which she excelled. After graduating from that program, she worked in the Mahaut Health District with the then district nurse, Nurse David, and in Massac, Nurse Demole. She also worked at the Princess Margaret Hospital and at the Roseau Health Center. Students who trained with her often referred to her as a wonderful. Subsequently, Nurse Murphy completed the midwifery program at the Princess Margaret Hospital, where she remained for a period of. She was then transferred to the Massac Health District as district nurse. Retirement. She retired at age 55, and not being able to find someone to replace her at Massac at the time, she was recalled into service and eventually left sick. Nurse Murphy served in the communities of Massac, Warner, Campbell, and Cochrane. Up to this, many individuals from these communities speak of her as a real community. She went to all nooks in the village to seek out the patient. Most especially, she loved the elderly and went out of her way to reach them wherever they were, no matter how far. She loved her vocation, and it showed in the way she interacted with patients. Kindness, standing, very easy. This is Nurse Murphy. Thank you.
Thank you, Piano. And we can now officially refer to the facility here as the Esprit Murphy Health and Wellness Center. Although Nurse Murphy and Nurse Esprit are deceased, this afternoon with us, we have Miss Deborah Blanford, who is a family of Mary Murphy. I think, Deborah, you would need to stand to take the kudos for Nurse Murphy. We also have Mr. Milton David, who is the family of Nurse Esprit, the son of Nurse Esprit. And thank you, Mr. David and Ms. Blandford. And we are always reminded in life that we need to do good. And this is why today Ms. Blandford and Mr. S. David can now take the kudos of what your parents and your family do during the earlier years. Again, we now officially refer to the Mahaut Center as the Mahaut Health and Wellness Center. On this Esprit, this Murphy Esprit Wellness Center. We now officially refer to the center as Nurse Esprit Murphy Health and Wellness Center. So I now invite Honorable Rayburn Blackmore, who I know is very proud this afternoon, who is the Minister for National Security and Home Affairs and the parliamentary representative of the Mahaut constituency, to give remarks.
Good afternoon, all. Let me first of all recognize our mix, Honorable Melissa Skerritt, wife of our Prime Minister, Member of Parliament for the Roseau Central constituency, Senior Minister, Honorable Osprey, and Minister for Foreign Affairs, Daro, representing the Prime Minister, Cabinet colleagues, Acting Secretary to the Cabinet, Permanent Secretaries, including the Permanent Secretary in the Ministry of Health. And also want to recognize all the officials within the Ministry of Health. Mahaut, good afternoon, especially the family members of the two distinguished medical practitioners who were naming this facility after. Ladies and gentlemen, people of Mahaut and the surrounding communities, today is indeed a tremendous honor and a great privilege to deliver remarks at what is a historic and momentous occasion for us here in the Mahaut constituency, as we gather here for the official opening of the new health and wellness facility, referred to thereafter as SP Murphy Mahaut Health and Wellness Facility. Brothers and sisters, to fully appreciate what we are getting here today, we need to have a historical perspective as to how the healthcare system in Mahaut evolved over the years. Ladies and gentlemen, it was Dr. Emery, John Emery to be more precise, after whom a ward in the Dominica China Friendship Hospital was named, who was responsible for setting up the first clinic in Mahaut in the year 1874. Dr. Emery was also responsible for influencing the passing of what was termed the Medical Aid Act that same year, an act that provided for the establishment of 5 health districts, and Mahaut, incidentally, was the health district number 2. This act also provided for the payment of a medical doctor to visit Mahaut and St. Joseph weekly. Mahaut, my dear friends, Mahaut has been on the national map for decades insofar as the provision of healthcare is concerned. A house was rented in Mahaut to serve as a clinic during the doctor's visit in that period I just referenced. But it was not until the 1960s under the first Labour Party, and that's important to underscore, the first Labour Party administration, that health centers were specifically built throughout this beautiful country, Dominica. This present location where we're now at, you can recall house the Mahaut Health Center. This facility subsequently was inadequate, and in 2001, under U.S. military-sponsored Horizon program, we had the construction of a facility in Backstreet, and I was instrumental, dear friends, in getting that done. Put your hands together for me. Thank you. Ladies and gentlemen, leadership matters. I say so because despite our many challenges, this Labour Party, under the leadership of Roosevelt Skerrit, has been able to pursue its developmental priority objectives. The opening of today's healthcare facility is truly a major step forward for us as we advance our effort in improving healthcare in this community and the entire Mahaut constituency. The people of Mahaut deserve the very best. And so today we open this modern state-of-the-art facility to bring quality health care to all the people of this constituency, recognizing that every citizen deserves to have full and unfettered access to health care. As a government, we believe that we must improve not just on the standard of health care, but also we have an obligation to the people of this beautiful country to ensure that there is equity in the delivery of care, so that someone's social or political circumstance or status is not going to determine on the Labour Party whether he or she gains access to health care or not. So this health facility is for everyone living in Mahaut, irrespective of a social, political, or religious persuasion. It is for you, the people of Mahaut, and I want to emphasize that. Clap again, please. Thank you. Ladies and gentlemen, thank you. Ladies and gentlemen, today's ceremony is also a period to salute all those who have served us over the years, over the many decades in our health system in Mahaut. To those who dedicated their lives, who gave so generously of their time, we honor you and we say thank you for your service. I want especially to recognize my good friend Deborah, the daughter of Mary Murphy, and my good friend who played cricket with me right there, Milton David. I'm so happy that you're here today, and Transetter, the nephew of Mary Murphy. Put your hands together for them. And again, I say thank you for the distinguished service. I am extremely pleased as a parliamentary representative to have been instrumental, yes, instrumental in the naming of this health facility. After two distinguished healthcare workers and stalwarts who gave many years of dedicated service to the advancement of healthcare in the most diverse and dynamic constituency, the Mahaut constituency. Mary Murphy and Nurse Agatha David Esprit, Nurse Esprit, who incidentally is the one responsible for that at the back of my head. I had my head burst twice in the same location. And on both occasions, my mother was very strict. She ensured that I walked down to Nurse Esprit to have my head stitched. And today, that mark is there for eternity. So therefore, my dear friends, Nurse Mary Murphy and Nurse Esprit were certainly the embodiments of the Mahaut spirit of excellence and caring. They were champions who went beyond the call of duty quietly. And so today, we honor their memory for service to community and country, for long, selfless work. Ladies and gentlemen, the people of Mahaut and the surrounding communities, you have waited and you have been granted the best quality healthcare facility. Nurse Esprit Mary Mahaut Health and Wellness Facility, the first of its kind. We promise the people of Mahaut that we are going to improve on the status of healthcare in this community, And after much planning and with the support of the Prime Minister and the Cabinet, we were able to undertake the construction of this most beautiful and magnificent health and wellness facility for you, the people of Mahaut and the surrounding areas. And it will be staffed with the best staff managed and operated on behalf of the people of the Mahaut constituency and the surroundings. Brothers and sisters, the opening of this facility is indeed a statement of intent by this Labour Party administration to improve the condition of lives and the livelihoods of the people of this community and to move them to a higher standard of sustained social and economic advancement. We in this Labour Party government believe that a prosperous and progressive nation must have the ability to provide high-quality health care to all its people. And so while your government has over the past few years have been embarking on the improvement of tertiary care in the health sector with the development of modern hospitals like the Dominica China Friendship Hospital and yes, the Mahaut Hospital, yes. We believe equally that there has to be a corresponding level of development of primary healthcare system with a network of community health centers, top quality professional staff, up-to-date modern equipment, but moreover, my dear brothers and sisters, a system of care which puts people at the center. And that is what the Dominica Labour Party exemplifies, my dear friends. Ladies and gentlemen, we are focusing on building a modern society that is driven by a desire for all our people to succeed, to be at the best. We have been placing particular emphasis on wellness and healthcare promotion to promote healthier lifestyle and self-empowerment among our citizens. Ladies and gentlemen, it is important that as a community, we place emphasis and attention to our individual responsibility and to be responsible for our health care. So today, my dear friends, we open this grand facility. It is important that we recommit to the mantra that your health is your responsibility. So while we must provide the best care for you, those of us who are impacted by diseases and illnesses, it is equally important that each one of us take greater care and attention to our own health care needs. So I must encourage you to watch what you eat, exercise more, to be engaged in sporting and cultural activities, to maintain healthy lifestyles. If we do these things, we are sure to minimize the impact of lifestyle disease, especially, hypertension, diabetes, etc. Ladies and gentlemen, we would also like to call on all the stakeholders in the Mahaut community to work more closely with the health team and to support efforts, especially in public education and awareness, as we seek to promote a new and more sustained effort for dealing with health issues, and even more so with the pandemic, COVID-19. We must see this mission for improving healthcare as a community effort with leaders and practitioners working together to ensure that we have a more robust health system and healthier community. Today we celebrate and we say thank you for this great gift by the Dominica Labour Party. We thank the government of Dominica and all those who made it possible. I want in particular to recognize MMC, and I really miss Mr. Timmins because he was so instrumental in this project, and may your soul rest in peace. I want to also take this opportunity to recognize someone. I want to say a special thank you to my colleague minister, Honorable Dr. Darrow. Put your hands together for him. He was the Minister for Health then, And I can recall writing to him and saying to him that we need a proper health facility in Mahaut. And he said, Blackmore, you're on the book. So when the 12 health center, the concept came about, I had very little lobbying to do with the Prime Minister. And today, we have this spectacular facility, second to none. Thank you very much, Dr. Darrow, and our Prime Minister and Minister for Finance. But before I conclude, I want to express, on behalf of the people of the Mahaut constituency, my most profound gratitude to the Labour Party administration and to the Prime Minister for the heavy investment that has been made, or have been made, sorry, in the constituency over the years. We promised this health center, or this health and wellness facility, before the election, and you got it. We promised you the Master indoor facility, and some said before the election it was a Blackmore and scary political ploy, but today it is standing there as an exhibit by the Labour Party. And the same folks asking to do a walkthrough, and I say no. We promise you apartments in Jimmet, and today 121 families are living in Jimmet. We promise you a brand new school, L-shape, and we promise you, and it will be delivered, and it will be the best in the island. At the right time and the right place, I will tell you why it's an L-shape. We promise the people of Checkall to improve the road, and you can see it for yourself. And the list goes on, my dear friends. Those of you who have not gotten your share, wait, and you shall get. Because the best party in the history of Dominica is in office, my dear friends, under the best leadership ever. But as I live, because I have 140 names, and they have said they want to take the vaccine, and they want to take the vaccine right there. I've already spoken to Dr. Mark, and he's setting you up. Others have said that they're scared, but if I take it, anybody can take it. And those of you who are scared, just do like King Hunter. Close your eyes and say, aye. And as we say in Mahaut, case closed, matter done. But please don't do like Cecil, no? So, on a more serious note, it is absolutely important to take the vaccine, because that's the only way out we're going to get ahead of this COVID-19 pandemic. And this thing about long and short legal, and the Prime Minister legal was short, it had nothing in it, and I want longer. Let us stop this nonsense. We need to give the Prime Minister his praises. And the fact of the matter is, the Prime Minister should be actually praised for being the first leader in CARICOM to get us an effective vaccine, and that is what the focus ought to be about. So, take the vaccine for your own good. You can recall when we had what you call lagum, mumps. Yes, lagum. I never got it, but a number of folks in Mahaut got it. Some of them there, I'm not calling them my friends. And then you had measles. And you had polio. What were the discontinued those ailments? For vaccines. So the fact of the matter is, if we're going to have any semblance of normalcy in Dominica, we have, according to the experts, not me, we have to vaccinate a minimum of 70 to 80% of the populace. So take the thing and take it just like a Honda, you're afraid? Aye, and finish with that. Thank you very much, my dear friends.
Thank you, Honorable Blackmore. Thank you also for the words of encouragement to the people of Mahaut and Dominica. Encourage them to take back. I am sure Ms. Luis I was very pleased to hear that, and Mr. Shillingford as well. I now invite our own Honorable Dr. Irvin McIntyre, Minister for Health, Wellness and New Health Investment, to
Let me first recognize Senior Minister Honorable Reginald Austri, Minister of Housing, Mrs. Melissa Skerritt, spouse of the Honorable Prime Minister, Parliament for Roseau Central Constituency, Honorable Kenneth Daru, Minister for Foreign Affairs, International Business, Diaspora Relations, and representative of the Honorable Prime Minister here today, Honorable RAYBURN Blackmore, Minister for National Security and Home Affairs, Parliamentary Representative, Mahaut Constituency, Honorable Kent Edwards, Parliamentary Secretary, Ministry of Health, Wellness and New Health Investments, other honorable members of Cabinet, Ms. Karen Prevost, Acting Secretary Cabinet, Mrs. Letitia Lestrade White, Acting Permanent Secretary, Ministry of Health, Wellness and New Health Investment, other permanent secretaries, Mr. Ahmad Al-Khatib, Project Manager, MMCE, Dr. David Johnson, Chief Medical Officer, Dr. Laura Esprit, Director Primary Healthcare, Mrs. TERRILLIA RAVALIERE, Acting Principal Nursing Officer, Mrs. Ermine Renee Roberts, District Nurse, other staff of the Ministry of Health, Pastor LENNOX Timothy, other invited guests, members of the media, and to you, the people of Mahaut, Belfast, Campbell, Warner, Despo, Jimmet, and all the neighboring areas visit center. Pleasant good afternoon to everyone. The truth is, we're only here today because of you. Without you, there's no need for a health and wellness center. And it's also an opportunity that you've given us to be here with you, because it's all about you. That's why we're here today. Secondly, we're here today because we care about your health and wellness. As a government, we have always put the people first. And by doing this, your health and wellness becomes our priority. Just like we have been taking care of your housing needs, the education of your children, taking care of the elderly, social programs, your infrastructure and safety, and all other aspects of the development, your health, no exception. That too is being done within a pandemic period. We need a time when most of the world is under lockdown. As a matter of fact, some countries are still under complete lockdown. But we are very pleased to be here today because we know how deserving and how patient you've been for your new health wellness center. I remember carrying out clinics at the old Mahaut Health Center more than 20 years ago. And if we go further back, we will recall the days when Nurse Murphy and Nurse Esprit walked through the communities, going from house to house, delivering health care to many of you here today and to your loved ones who passed on. It sometimes involves riding on horseback, bicycle, and using a bullseye, as was mentioned earlier. Today, when I look at this structure and the services we are providing to you, the people of Mahaut and the surrounding villages, it's very comforting, bring great joy. Your government has put you, the people, first in everything that we've done. This is the first of the 12 new health centers to be commissioned. We have completed 6 so far, and next week we will continue with Georgetown, Bellevue-Chopin, Becaz, Marigot, Wesley. The remaining 6 are nearing completion and will follow very soon. This is going to be the platform from which primary health care will see its vision and propel its mission in providing health care to you, the people. A healthcare service that is interactive, one that will focus on prevention rather than cure. A primary healthcare service in which health education and promotion will play an integral part in the delivery of services. A service that will address our behavior and help us adjust and adopt healthy lifestyle. Service that will engage us regarding how we eat, how we exercise, and the way we live our lives when diseases. Our intention is for you to have a good experience with the best possible outcome. But you, the people, the beneficiaries, must play your part as well. You must attend your clinics. You must take the advice of your healthcare workers. And very importantly, you must hold your health and wellness center. It belongs to you. Take care of it. Don't litter and don't deface it. Let's make this facility and the surroundings look even more beautiful as time goes along. It is important to note that with the completion of our 12 new health and wellness centers, we will have the most of these facilities per population in the entire region. As a nation, this is something we should be proud of. And you must also remember, all of this is being made possible with funds from the CBI program. So you, the people, have a vested interest in protecting and defending our CBI program. Although we are here today to commission the new Health and Wellness Center, allow me some latitude and permit me to mention our vaccine rollout program. As a nation, we have truly been blessed to be in a position where we are providing COVID-19 vaccines to you, the people. Many other islands are still waiting to receive their first vaccine, let alone begin a vaccine rollout program. Here we are in Dominica with our vaccine rollout in full swing, to the extent that we have even helped some of our sister islands in vaccinating their frontline workers. We should not take this for granted. We should be grateful and we should be thankful and appreciate the luxurious position we are in today as regards to COVID-19. We've had no deaths, and vaccination is one of the ways we can keep it that way. We're extremely pleased with the response so far and must thank you, the people, and for acting responsibly and taking part in the biggest vaccination program this country has ever seen. Our vaccine program is voluntary, and some individuals may have their reservations regarding vaccines, and in all fairness, that is understandable. But it is very unfortunate that some people have politicized the vaccine rollout. We're in the middle of a pandemic. This is not the time for party politics and petty. This is not the time for cheap. It's all about saving lives and getting back to normalcy and optimal productivity. Your government is focused on protecting you, the citizens of this country, and will do so by all means necessary. My dear people, help us to help. Make use of your health and wellness center. Take advantage of your vaccine program. Let us build a healthy nation. I would like to thank MMC for a beautiful final product. I'd also like to thank the entire health team and the planning committee for today's event. And my deepest thanks goes out to all frontline workers. God bless you.
Thank you, Honorable Minister. Nashel Walter. So we now invite Nashel Walter, Mahaut, to do
Good evening, everybody. It's a pleasure to be here. So this song I'm going to sing is entitled Good Job. And I feel that the nurses, the minister, everybody deserves it. Because if it wasn't for that, then we wouldn't all be here today. You're the engine that makes all things go. Always in disguise, my hero. I see your light in the dark, smile in my face when we all know it's hard. There's no way to ever pay you back. Bless your heart, no, I love you for that. Honest and selfless, I don't know if this helps it, but good job. You're doing a good job, a good job. You're doing a good job, don't get too down. The world needs you now. Know that you matter, matter, matter. Good job. You're doing a good job, a good job. You're doing a good job, don't get too down. The world needs you now. Know that you matter, 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 yeah. 6 in the morning. As soon as you walk through that door, everyone needs you again. The world's out of order. It's not as sound when you're not around. All day on your feet, hard to keep that energy. I know when it feels like the end of the road, you don't let go, you just press forward. You're the engine that makes all things go. Always in disguise, my hero. I see the light in the dark. Smile in your face, but we all know it's hard. There's no way to ever pay you back. Bless your heart, know I love you for that. Honest and selfless. I don't know if it helps this, but good job. You're doing a good job, a good job. You're doing a good job, don't get too down. The world needs you now. Know that you matter, 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 yeah. You're doing a good job, a good job. You're doing a good job, don't get too down. The world needs you now. Know that you matter, matter, matter. The nurses beneath us teach us that reach us, strangers to friends that show up in the end. From the bottom to the top, the listeners that hear us, this is for you. You make me fearless. You're doing a good job. You're doing a good job, don't get too down. The world needs you now. Know that you matter, 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 yeah. Thank you.
Thank you, Miss Walt. I am sure many of us, beginning on me being a nurse also, we can appreciate what Miss Walt was singing. But I just would like to encourage all of us, health providers, let's just remain focused. Not an easy task, but we're doing the best we can and we achieve it. Let's continue. Let's put a round of applause for all our healthcare providers. I would now like to invite Honorable Dr. Kenneth Daru, Minister for Foreign Affairs, International Business and Diaspora Relations, who is representing the Honorable Prime Minister.
Thank you, PS. Let me first recognize the presence of the Honorable Reginald Osh, Senior Minister, Mrs. Melissa Garrett, spouse of the Honorable Prime Minister and also Member of Parliament, Rosa Central Constituency, Honorable Dr. Kevin McIntyre, Minister for Health, Wellness and New Health Investment, my friend and partner, Honorable RAYBURN Blackmore, Minister for National Security and Home Affairs and Member of Parliament for the Mahaut constituency, Honorable Kent Edwards, Parliamentary Secretary in the Ministry of Health, Wellness and New Health Investment, other cabinet colleagues present here in large numbers today, Ms. Karen Privot, Acting Secretary to Cabinet, Mrs. Letitia Lester-White, Permanent Secretary in the Ministry of Health, Wellness and New Health Investment, other permanent secretaries, other top government officials present, Dr. David Johnson, Chief Medical Officer, Dr. Laura Esprit, I hope I get that correct, Director of Primary Healthcare Services, Mr. Ahmad, Project Manager, MMC, Ms. TERRILLIA RAVALIERE, Principal Nursing Officer, Mrs. Ernie Robert, District Nurse, plus other officials of the Ministry of Health, Pastor LENNOX Timothy, other invited guests, members of the media, ladies and gentlemen. Let me begin by first apologizing for the absence of the Honorable Prime Minister, who we all know would have loved to be here with us today celebrating the first day, but other urgent state matters led to that not being possible. But he sent his love and congratulations to you, the residents and member of parliament, of course, of the Mahaut community and surroundings, and of course his best wishes for today's ceremony. I am also honored to have been invited to represent the Honorable Prime Minister on this very important occasion. Not just invited me, but also allowed me to share a few remarks. Ladies and gentlemen, in keeping with the National Development Strategy and in the quest to provide quality health services, the government of Dominica recognized the importance to continue the decentralization of health services throughout the island. Moreover, our experiences with Tropical Storm Erika in 2015 and Hurricane Maria in 2017 showed us the need to have resilient healthcare infrastructure throughout the island. Consequently, when the policy decision was taken to build these new health facilities, climate resilience considerations were among the key issues, and in keeping with government's focus to transform the health services, the construction of these new and resilient health facilities was planned and constructed with the concept of wellness in mind. To put this into perspective, the state of wellness is much more than the absence of illness. It is the pursuit of the best possible health and well-being. The government's focus on transforming and strengthening of the health system is a progressive implementation process which will ensure resilience, particularly at the level of primary health care, and address the broader determinants of health, as well as the comprehensive and interrelated aspects of physical, mental, and social health and well-being. For us in Dominica, access to primary health care services is one of the pillars of our health system, and government's policy on ensuring every single citizen of this country has access to basic health care services is fundamental. And on no account should our elderly and senior citizens have to travel very far to access the health providers, be a doctor, nurse, a pharmacist, for simple management of their chronic level conditions such as diabetes, hypertension, right, among others. The passion to care for our citizens and to ensure easy access to the services was one of the main driving factors in embarking on the construction of these new and modern health wellness centers. Ladies and gentlemen, healthcare is a commodity which everyone consumes, so no one can deny that there is no better way to touch the life of people than to prevent people from getting sick, and when and if they do get sick, to care for them in a loving, humble, and respectable manner. In other words, to treat them with dignity. Thus, the government of Dominica remains committed to provide the best medical care available within the primary health system. Furthermore, our primary health care services model will continue to drive the national health system, and we will continue to upgrade the healthcare facilities and services throughout the length and breadth of this beautiful island, and no community, I repeat, no community will be left behind. This government believes in a healthcare system that cares for the people it serves, regardless of the ability to pay for the services. It is a fundamental principle why there is no direct cost to our citizens in Dominica in accessing healthcare services at the primary health level. We are therefore hoping that this health facility, and of course the many others like it, will promote the whole concept of wellness from the Mahaut community and surroundings. Ladies and gentlemen, it is a privilege to commission this facility today in recognition of Nurse Agatha David Esprit and Nurse Anastasia Mary Murphy. Their commitment, passion, and dedication to serving others so selfless must be emulated, and we salute the family and friends representing them here today's ceremony. We thank you for them. Today's ceremony, this the commissioning and naming of the Health and Wellness Center here in Mahaut, is a significant one. And I say significant for a number of reasons. Number one, significant because of what we just described. what it means to the life of the everyday Joe and Jane public here in the Mahaut community and surrounding. It means that they can finally have a top-class, modern, climate-proof health facility where they can access a various number of health and wellness-related services. In fact, and Honorable Blackmore alluded to it, I remember as a former Minister of Health visiting the old health facility a few minutes from here, especially post-disaster, and listening to the concerns of the staff and clientele alike. Not to mention the sometimes very forceful advocacy at the cabinet level made on your behalf by your very own Member of Parliament, Honorable RAYBURN Blackmore. 2, this ceremony is of even greater significance when placed in context of the current reality that we are living in, because this is happening right before your eyes. Your government is in the process of building and commissioning 12 brand new climate resilient health facilities. And in addition, and this is in addition to 2 major hospitals in Roseau and Marigot, against the backdrop of a global pandemic, and I speak to the SARS-CoV-19 pandemic, that apart from the millions of hospitalizations and deaths, a pandemic that has left economies the world over in shambles, ladies and gentlemen. And I'm not just talking about developing emerging economies like ours. I'm talking about mature and stable ones. I need you to think about this for 1 minute. Ladies and gentlemen, what your government has been able to do from the onset of this global SARS-CoV-19 pandemic is nothing short of phenomenal. And we should never, ever take this for granted. I repeat, we should never, ever take this for granted. Your government has from the start put measures in place to minimize the spread of the disease here in Dominica. Measures that most certainly work, as the numbers speak for themselves. And we have been hailed as one of the countries who have dealt with this global threat in the best possible way. Reliable, friendly countries and other partners, thank you, such as the Republic of Cuba, the People's Republic of China, and many others made it possible that we had ample supplies and the human resource to assist in the fight against this deadly virus. And I would like to thank them for their kind intervention. Ladies and gentlemen, in more recent times, in fact, 2 weeks ago, to be precise, your government has made available to its populace a world-class vaccine at absolutely no cost to them. And again, I think the Honorable Blackmore alluded to it, that this was not achieved from any multilateral platform or negotiation, ladies and gentlemen, but on the wisdom, vision, and foresight of the leadership of your Honorable Prime Minister, who saw it prudent at the time to reach out to the Prime Minister Modi of India, making such an ambitious request on behalf of his people. And on this note, I would like to take this opportunity to thank the government and people of India who so graciously made this donation to us so we can begin to vaccinate our population, getting closer to the herd immunity threshold that most countries are aspiring to achieve. Ladies and gentlemen, again, I plead to you, this should not be taken for granted. Because even as we speak, there are 130 countries, 130 out of the 190 somebody United Nations countries, 130 countries that are yet to see any vaccine reach their shores. I need you to digest this for a minute. 130 very anxious world leaders presently, with their populations panicking, breathing down their neck, most of them uncertain or clueless as to where and when the very first vaccine is going to appear. We need to digest this, because these vaccines that are now available to us for free is fast becoming the new global currency. To put it simply, my dear friends, Dominica is way ahead of the curve as far as vaccines are concerned, and indeed we are leading the way in the region as far as the availability of a safe, reliable vaccine and actual immunizations are concerned. Ladies and gentlemen, we have always said, and I'm saying here today, and we will continue to say, that indeed leadership matters. In closing, let me also thank all those involved in the processes leading up to today's event, the developers, MMCA, friend Ahmed, and the various subcontractors, staff of the Ministry of Health and other government agencies and departments who have been on board ever since the initiative was launched some time ago. I really would like to thank you all for listening to me. I hope I wasn't too long and boring. And in closing, encourage each and every one of you above the age of 18 to go get vaccinated. Do not wait until it's too late when the vaccines are non-existent, not available, or maybe active for them. Until it's too late, because as the old people would say, he would deserve to shoot tota. I thank you very much, ladies and gentlemen.
Thank you, Honorable Minister. I would now like to invite Mrs. Renee Roberts to do the vote of thanks. Mrs. Renee Roberts, one of the nurses who work together with this law, Mahaut Health Center, and we felt it fitting that Renee Roberts, that
Mrs. Melissa Skip, spouse of the Honorable and Parliamentary Representative of the Rose. Honorable Kenneth Daru, Minister for Foreign Affairs, International Business and Diaspora Relations, and representative of the Honorable Irvin McIntyre, Minister for Health, Wellness and New Health Investment, Honorable RAYBURN BLACKMOORE, Minister for National Security and Home Affairs, and Parliamentary Representative of the Mahaut constituency. Honorable Kent Edwards, Parliamentary Secretary, Ministry of Health, Wellness and New Health Investment. Other honorable members of Cabinet, Ms. Karine Privot, Acting Secretary to the Cabinet, Mrs. Letitia Lestrade-White, Permanent Secretary, Ministry of Health, Wellness and New Health Investment. Other permanent secretaries, Mr. Ahmed Al-Khatib, Project Manager, MMCE, Mrs. TERRILLIA RAVALIERE, Acting Principal Nursing Officer, Pastor LENNOX Timothy, other invited guests, members of the media, ladies and gentlemen, a pleasant good evening all. I am truly humbled this evening, having the esteemed opportunity to express most heartfelt gratitude to the Prime Minister, the Government of Dominica, and all stakeholders for the construction of this visit center. Mahaut is a very large and vibrant community, the village that never sleeps, as it is commonly called. Having worked in this community, I can attest firsthand that the clients make exceptional use of their health center and the services provided by the primary healthcare system. Ayomolowo et al. 2013 stated, a healthy work environment for healthcare nurses is an important factor in improving work satisfaction, reducing turnover intentions, and improving nursing care outcomes. Therefore, I believe I speak for everyone when I say that it truly feels wonderful to both provide and receive care in this modern, comfortable, state-of-the-art health center, the Esprit Murphy Health and Wellness Center. Special thanks also goes out to MMCE under the able management of the late Christopher Timmins. We were all saddened by his passing and wish he could have gotten the chance to celebrate with us today. We wish to thank the chairperson, Mrs. Letitia Lestrade-White, for the smooth flow of this ceremony. We would also like to single out and thank Pastor LENNOX Timothy for your blessing. We wish to thank Mr. AKEEM ISHMAEL for his wonderful melodious vocals. We wish to thank Honorable Kent Edwards for his warm remarks and the importance of primary health care services, highlighting the importance of primary health care services in Dominica. The Honorable Mr. RAYBURN BLACKMOORE, we would like to thank you for allowing us to relive the primary health care services of the past and the career of the hard-working stalwarts of the Mahaut healthcare system. Mrs. TERRILLIA RAVALIERE, we wish to thank you for the picturesque description of the careers of Nurse Esprit David and Nurse Murphy. Dr. Irvin McIntyre, for encouraging the use of the facility, and I do know that the Mahaut constituency, the Mahaut clients will definitely make use of this. Miss Nashel Walsh, for your expression of appreciation. I can speak for all when I say we were truly touched by the words presented in your song. The Honorable Kenneth Daru for stepping in and delivering the feature address. Also for reminding us how blessed we are in Dominica, and not only with words, but with figures, with statistics. We also wish to thank all who were involved in this ceremony, preparation for this ceremony, including the cleaners and the NEP workers for planting the beautiful flowers that you see here in an effort to boost the aesthetics of the building. On behalf of the Primary Healthcare Department of the Ministry of Health, Wellness and New Health Investment, and the members of this community, I again wish to say thank you, thank you, thank you. And may the Almighty Father continue to bless our government and this beautiful country. I thank you. Bless evening.
And I say thank you to you, Miss Nurse Renee Roberts, for delivering the. We will now have a presentation of the bouquet to Mrs. Melissa Skerrit, the spouse of the Honorable Prime Minister and Parliamentary Representative of the Roseau. So we have a young lady. We also have a presentation to make. We can't repay this Murphy or this Esprit, but would like to show appreciation to the family. So I call on Mr. Milton David, family of Agatha Esprit David, the son, Agatha Esprit David, to receive a basket in appreciation. I would also like to invite Miss Deborah Blanford, family of Mary Murphy. Mary Murphy also receive token of appreciation. And Miss Blanford, at your request, we are allowing you.
I just, my family asked me to say a few words because I represent them here. My daughters, my siblings, as well as my mother's sibling. She was the glue that held the family together, not just in the community, but at home. And they said to say that they are very moved by the recognition and that they are very appreciative that she has been remembered for her work, because she did it without pay. And even Nurse David was the nurse because she was closer a lot of times, and she worked in Massac for a lot of the time because she was closer. They came to her rather than walking all the way down to Nurse David. So thank you very much.
Thank you. So we are approaching the end of our ceremony, and we'll now move on to the unveiling of the plaque. The plaque is at the entrance of the facility. The Honorable Minister has also requested the family of Nurse Esprit Murphy to accompany him for the unveiling of the plaque. Following the unveiling of the plaque, we will proceed to the cutting of the ribbon, and Honorable Dr. Kenneth Daru, accompanied by this beautiful young lady sitting in her Creole wear, will also accompany him for the cutting of the ribbon. Then we will proceed to the blessing of the facility by Pastor LENNOX and a tour of the facility. In maintaining social distancing and our health protocol, we would like you to allow the ministers of government and the permanent secretaries enter the building first. Your hands will be sanitized again upon entry to the building because the Mahaut Health and Wellness Center is already in use. Following this, we will allow other members of the public to view the inner part of the health center. So we now move on to the unveiling of the plaque, and I would ask members to join us.
We are live here at the Mahaut Health and Wellness Center, which has been formally named the Esprit Murphy Health and Wellness Center. Making their way towards the entrance is the Honorable Kenneth Daru, who is representing Prime Minister Skerrit. He's accompanied by the Honorable Irvin McIntyre, who is the Minister for Health, Wellness and New Health Investment. Mrs. Skerrit is also here, the wife of the Prime Minister, the parliamentary representative for the Roseau Central constituency, as well as the parliamentary representative for the Mahaut constituency, Honorable Rayburn Blackmore. Senior Minister, Honorable Reginald Austri, is also here, and so too is the daughter of Nurse Esprit and the son of Nurse Murphy. So they have made their way where the formal unveiling of the plaques are to be taking place. The formal unveiling of the plaques are to be taking place, and we see that Dr. Daru, Honorable Blackmore, is here, and very soon the plaques are to be unveiled by the Minister for Health with the assistance of members of the family of the two distinguished ladies. And the Minister for Health has made way for the children of the two distinguished ladies for the unveiling of the plaques in their honor. This new facility named after Nurse Esprit and Nurse Murphy, and very soon the plaques will be unveiled, and they're being done so now. The Esprit Murphy Health and Wellness Center, the first of its kind to be officially opened here in Dominica, and we're doing so in Mahaut, a community of just over 2,000 residents, which is almost evenly spread as in male and female. It is in the Roseau Health District, and it has officially commissioned the first of its kind, the Esprit Murphy Health and Wellness Center, dedicated to the memory of Nurse Agatha Esprit and Nurse Mary Murphy. We move towards now the cutting, the official cutting of the ribbons there, and we will try to get the official cutting of the ribbons there for the official, which will mark the official opening of the Esprit Murphy Health and Wellness Center. So we are going to see, I am not sure who is going to cut the ribbon, but I think it is Dr. Daru who is going to do it, and the pastor is now blessing the building there before we have the official cutting of the ribbon. A word of prayer before we have the official cutting of the ribbon. So that has happened, and Dr. Daru is soon, and the young lady there is soon going to cut the ribbon there. So let's see. There we go, and the cutting is taking place at this time, and yes, it is finished now. So it's official. The Esprit Murphy Health and Wellness Center is officially open in Dominica at this time, and the officials are going to get a tour of the facility. It is a state-of-the-art facility comprising of 2 clinics, comprising of nurses' bay, comprising of pharmacy and doctors' offices, of course, washrooms. And it's a very historic occasion in Dominica. Yeah, very historic occasion in Dominica, the opening of the first health and wellness center. 12 health and wellness centers are being constructed across Dominica. 6 of them to be opened over the next 10, and I think very soon the rest will follow. So we are here in the community of Mahaut, described as the village that never sleeps. We're in the village that never sleeps, and the are entering are there. The government ministers who are there are going to enter the building as we speak, and then we are going to see the just a small tour of the facility taking place here. Okay, so the ribbon has been cut. We have officially opened the Esprit Murphy Health and Wellness Center, and the Esprit Murphy Health and Wellness Center dedicated to the memory of Nurse Agatha Esprit and Nurse Anastasia Mary Murphy in recognition of their outstanding contribution to nursing in the Commonwealth of Dominica. Reads at this time, and we are very happy for that. Yes, very happy for that. I'm going to try to make my way closer into the building. This as a number of government ministers seek to enter the building at this time, and it is indeed a very happy occasion that is taking place here in the Mahaut constituency. I see some family members and the Minister for Education who has just entered, the Minister of Public Works who is also from the Mahaut area is also here, and so too the Minister for Blue and Green Economy, National Food Security and Agriculture is also here as well. I also see a number of healthcare workers. They are here as well, and it's good to be part of such a historic occasion. So we are inside the facility at this time. If I were to just grab one or two ministers there and ask them, their thoughts on the opening of this facility. Minister Kasani Laville, who I know is from the Mahaut area, what are your thoughts on the opening of this facility here today?
Well, this is certainly a proud moment for all of us, and for me being in Mahaut, Daryl, it's a wonderful day, a day we've been waiting for. I actually am very familiar with this site in Tiza. I went to preschool here, and I also went to clinic here in the previous site. So being here today for me, it's certainly a momentous occasion. The facility is splendid. It's built to an extremely high standard, and it's a wonderful thing for the people of the Mahaut constituency and the environs. So again, I'm happy to be here. Looking forward to the opening of the health and wellness facilities around the island. There are quite a few more to come. So we're going to spread the love, the care, and so on, and the joy for so many more Dominicans in the various communities. So again, joyous moment for everyone. I'm encouraging everyone in this constituency, this community, to make the best use of this facility. Let's take care of it. It comes in at a high cost because it's high quality. And we're just looking forward to great things for this constituency and community.
Thank you very much. I'm going to pull the nephew of Nurse Mary Murphy. How do you feel today, Narin Murphy, that this facility is being named after your aunt?
I'm very much elated and pleased and thankful that my auntie, who did a fantastic job in the community, not just of Mahaut, Massac, Warner, and the surrounding communities, that the newly opened health center, wellness center, is being named in her name, partly. So I'm very happy. She worked very hard. She was like a 24-hour nurse. She did it not just for money, but because it was just something that was coming from her naturally.
What would you like to say to the government for recognizing your aunt at this time?
Well, I want to thank the government for recognizing a pioneer, a stalwart in the healthcare, primary healthcare, in form of my auntie, Anastasia Mary Murphy. It's really appreciated, and the family is very much grateful for that recognition.
Thank you very much, Mr. Naren Murphy, known as the trendsetter in Calypso world, and today a proud family member who is viewing that this facility named after his aunt. I'm going to try to speak to a nurse. She's going to try to go through. Nurse. Nurse just running away there. Nurse, just a little thing. The nurse being shy there for a minute. I will try. Let me see if I can get the Minister for Education. Minister, just tell me what you think of this facility here.
I think it's wonderful. I think it's very modern. I like that you can actually refer to it as a mini hospital. I think these centers will ease up the stress, the flow into the general hospital, which will make things easier for those people at the accident and emergency, even on the wards, because there are so many things that could be handled right here. It also makes it less stress for family, because you don't have to go to Roseau to see your people who are sick, because they are close to home. You can peep in and pop in and almost, So I think it makes you feel as if it's an extension to family, and that is what family care too is all about, that you can be closer to those you love. I mean, if a person comes in and you have 4 little children at home, it makes you feel as if you are still at home with them instead of having to be at the general hospital and there. So I think it's a good thing, and I'm happy that other communities will also get theirs. For us in education, it is a complement to education, because if children are in good health, they learn better. If parents are in good health, they take better care of their children. If the country is in good health, then students do better at school, they miss less school, and they perform better. Thank you.
Thank you very much. I'm going to talk to a community stalwart, Miss Annette Bates, at this time. Miss Bates, how do you feel that this facility is being done, open here in the Mahaut constituency?
This is beautiful, and it's well needed. And I think the people of the community will make very, very good use of it. Don't deface this building, because it's for all of us. And we needed it, and we have it, we get it, and we will have to learn to appreciate it. And let's thank the government for all they have done and all they continue to do for us here in this country, especially in the Mahaut area, because we got our fair share in this community from the government. That's why we must continue to support the government, because they look out for every one of us in this country.
Thank you, Ms. Bates. Well, you have it here, the official commissioning of what is now the Esprit Murphy Health and Wellness Center coming into an end here in the Mahaut constituency. Members of the public are getting a first-hand view of what is going on here. They can see this type-free health facility in their community, the first of its kind to be opened in Dominica, but 12 of them being built across the island. We have 5 more to do over the course of the next 12 days. We're looking at Vickers, Bellevue Chauffeur. We also go to Georgetown in Portsmouth, Wesley, and Marigot as well. And of course, there are still some under construction in Bagatelle, Ansdeme, Soufriere, Collyho, and as well as Newtown. So on behalf of all of us here from the GIS production team, including Edward Philogen, Albert Toussaint, Ashton Shillingford, Anthony Richards, Dezan Peltier, and Clyde John Baptist, I'm Daryl Titt, returning you to the studios of the Government Information Service.